one of this group is absent today because he's sick, so two of the other group members are going to present his slides.
All right, good morning, guys. For our needs analysis, we have split them. I'm basically doing three steps for the needs analysis. The first step actually talks more about the problem, and we talk about contributing factors, the gaps within this current system services that are resulting from the contributing factors, and we also talk about the sources before we go ahead with what we're trying to achieve, and what are the current services actually happening here in Australia and in outside countries, outside Australia. And out of those things, what we are proposing the best strategy for addressing the needs. And then obviously we're going to talk about the barriers. All right. So according to the Australian Childhood Immunisation Register, which is actually a part of the government organization which maintains lots of, the whole of immunization records for children below the age of 20. And what they're actually recommending is to attain a 95% full immunization rate for among these age groups. And right now, Australia as of now stands at 89.2% for children of 2 years of age. Now, why we've chosen children of 2 years of age is because we have compared these different age groups. For example, we've compared age 1, age 2, and age 5. And we've seen the improvements over the years, since past a decade. I've seen the improvement rates for age 2 was pretty much not that great actually. It's pretty disappointing, like 1% improvement over the years. And that makes it really interesting to get into it. And so this is how we got in. So we first looked at Australia, and then we then went down to states. So in Victoria, we noticed that these approximately 42 suburbs had these very low vaccination rates. That explains the gap that we've noticed at the national level. These low vaccination rates below being 90, one of the suburbs most interesting was Dandenong. Dandenong actually has vaccination rates of 84.8, like 85%. It's a risk. It's a huge risk because recently there's been outbreaks from I can say from 2006 there's been increased outbreaks for whooping cough, for measles, and the Department of Health actually proposes that it's probably because of these viruses that are being imported from outside countries. So Dandenong actually is much interesting in that perspective because it's a multicultural society. You have a lot of people coming in. You have a lot of settlements of migrants and refugees. So yeah, it makes that's what the evidence says. There's high chances of vaccine preventable diseases in such highly affluent suburb cities. Before I just want to show you a diagram though. This one. So these are contributing factors. The outer rim, which is the blue bubbles you have, which is what we used to like to call it. So you can imagine people coming from outside. Usually, we cannot expect them to have a very high proficiency level of English. So data suggests that there is huge amount of language barrier. There is a low education level regarding immunization and awareness of the benefits of the immunization happening. Even the main problem is the change of location. There are people who are changing location and they don't know where to go. Where can they take the children for vaccination? What sort of vaccination is required? So all those things actually play along, and they just move towards the second part, which is lack of access to information. So our emphasis here is on information, getting that right information at the right time, so that they can access the right vaccinating the provider, which is closest and most convenient to them. Yeah. So now this brings us close to the gap analysis part. So the first thing is like there are providers who are providing reminder systems to families that they need vaccinations. The problem is it's inconsistent. There are some providers who might have all the technology to remind their families in terms of telephone calls, in terms of posters, postcards, and there are some which might just not have at all. GP practices probably, and yeah. Also, you're going to have families who are coming in who have probably a lot of language barrier, who don't know what's happening around. There are going to be free vaccinations going on in the background, but they don't even know where to go. Or they might think that it's going to cost them a lot. So that's something important. Another thing about in particular to Dandenong. Dandenong actually provides very good information on immunizations. All the sessions, all the timings, all sorts of locations going on online though, and it's given in different languages. So that information is there, but who's able to access them? That's the question. There are people showing up at the vaccination areas, but again, there are some people who are just falling through the cracks. Yeah. So now, if we just consider our resources before we go ahead, our data is all of it is secondary data. We have collected data from literature. We have collected data from government documents, fact sheets, databases, different sorts of data statistics databases. And the problem we noticed is there are some minute variations between them, not much. And the best was to average out and get the best one. Solution, we believe, yes, definitely forming a coalition, talking to community members, talking to stakeholders about all the different perspectives from public point of view and providers point of view. Stakeholders, definitely we have parents, we have local councillors of Dandenong. Higher structures we are definitely considering for Department of Health and Human Services, and as well as ACIR, which is the Australian Child Immunisation Register, and vaccination providers. Definitely we have nurses, GPs, practice managers, pharmacists. So in summation, what we are trying to achieve is this: we already have that 85% of vaccination. What we're trying to push the bar, get it as close to 95% to attain the herd immunity, which is basically immunity against most of the known vaccine preventable diseases. So the thing is, this is going to be achieved really focusing on 2-year-old children within the Dandenong community who are living in these pockets of low socioeconomic status areas. And my colleague would now carry on further from there.
Thank you, Salman. So as we've already seen, there is the ACIR, which stores all your information on immunization for your child, right? Now let's take a look at what is actually present. First of all, whenever a child is born, immunization takes place on day 1. You have BCG, hepatitis B, etc., which is given to the child. Now what happens is the nurses feed in the data, it's recorded in the ACIR. Secondly, what happens is they give you a book in which your next immunization schedules, all of these are recorded. So you have to open the book, take a look at which date is your next immunization schedule, and go to the hospital or fix an appointment, go to the hospital, blah, blah. Okay. The second thing they've also done is they have a no jab, no play or no pay policy in which the government stops the Centrelink benefits if your child is not immunized on time. The other thing is you can't put your child in childcare. Yeah, you can't put your kid in childcare if he is not immunized totally. That also applies when they grow up and go to school also. They don't get into the school. Lastly, some of the hospitals do have a recall system, but these are hospital based. So what happens is there's a government app, and then they do the propaganda for the app. You have to install your own app and take a look. And we've taken a look at the Play Store and the App Store. Not much downloads have taken place, and the reviews are also not too good. Yeah, it doesn't remind on time. Okay, so there was one beautiful policy in Canada. What happened is, in Canada, if your child is born, you go to the website, you put your name, you put your child's name, you put your date of birth, and then it automatically sends you a reminder system, a reminding thing like an SMS or something. So you can get your child vaccinated on time. So this was taking place in Canada.
2 minutes.
Yeah. So what is our proposed strategy? Our proposed strategy is this. It's sending off an SMS. So literature reviews suggest that there is strong evidence which suggests that when you have a recall system in the form of a phone call or in the form of an SMS, which is cheap and cost effective, it helps the lower socioeconomic status more often and more easily and boost the immunization rates. So our proposed strategy is not to rely on any particular third party service for reminding you that ACIR has told you, okay, go and get the immunization done on that particular day. So to fill in the gap, our strategy is not a new strategy. We're just taking existing information from different sources, combining it together, and just sending an SMS. Now, what benefit do you get by that? Number one, your parent gets to know what time the immunization is to be taking place for your child. Number two, it is irrespective you have a mobile data or not, or a smartphone or not, you get an SMS. If you have changed your location, you just type in the postcode like 30232 Bamigbele, and then it gives you the local centers wherever the vaccination is going on. Lack of awareness, the message spreads a lot of awareness. And coming to language barriers, it gives you a link in which you can go to the website which already has 11 languages and take a look at what those stuff is remaining. Of course, we don't say that our system is foolproof. We do have a little barriers. Number one, as I told you, there is a language barrier which we can bypass by having a link.
1 minute.
The second thing is data privacy. Not everybody will be okay by giving their phone numbers to the ACIR. So we also have an option in the SMS to opt out of the service. Coming to approval and recruitment, yes, the level is divided into three, into the federal government, and then you have the Department of Health of Australia, and then you have locally, you have the local council, and ACIR, you need to club all these together and then go ahead with the project. So lastly, I want to conclude that there is a need, the need being the low immunization rates, which is 85, and we want to shift it to 95. And we are going to do that by proposing a simple strategy, that is introduction of an SMS, which is already based on the ACIR's information. It is just putting an SMS into the hands of the people. Just as everybody has a smartphone in here in this room, everybody we believe also has a phone at their place, and we want to bring that information to them so that they can get their child immunized on time. Thank you. These are the answers.
So, group 15, you've got a couple of minutes to put your questions together.
I've got a question right away, if that's all right.
Yeah, sure, please.
That was a great presentation, thank you, Matt.
Thanks.
I had one question that,
Could you speak up a bit, please?
yeah, sorry.
Thanks.
One question about barriers to vaccination. Just wondering, you didn't mention things like the anti-vaccination propaganda.
Yeah.
Pretty prevalent. How do you think that impacts on the population that you're looking at in Dandenong?
Yeah. Essentially about barriers, there are two things. There is access to vaccination and there is acceptance.
Yeah.
And what you're talking about is acceptance. And we found out from research that around half of the cases of non-vaccination are due to access problems. Access problems are rooted in structural issues in society, income inequality, cultural issues, and all that. But the proportion of people who are like conscientious objectors to vaccination are just around 2% of the population. So essentially, we decided to target this community who have an access problem, basically. Acceptance is not a substantial problem with this population. Research also shows that a huge proportion of the group that are in the anti-vaccination movement are mostly highly educated people in the society and all that. So, but for Dandenong, we decided to focus on access because that's the major problem in that cohort. But I do understand.
Yeah, and the second thing is the website also has a lot of information on the given to with the link that's provided in the SMS, and this also suggests what all happened back in Britain about the study which was the wrong study.
It's really interesting, your answer that it's only about 2% in that area just because...
Can we have another question, please?
Sorry.
That's all right, we haven't got a lot of time, that's fine.
Thank you.
Okay, one of your colleagues, please.
So, when you're trying to do an SMS bank, so is it going to include all the language barriers and everything? Do they have going to access? Because there is
Exactly, like I said, most of the North Africa and Middle East speak Arabic. So the website has already had 11 languages in it. So what we're going to do is, along with the SMS, we're providing a link. They just need to touch the link to go to the website, and then they can access them in all their languages. Of course, we do need to talk down about providing languages, providing SMS in different languages, but that's going to take a lot of effort. So right now we focus here, and we're going to provide a link.
Consumers, when they're going to get this information about SMS?
Yeah.
Is it like when they're going to be first contacted the immunization clinic?
Exactly. Whenever a child is born, he goes to the hospital. Of course, when the child is born, he'll be in the labor room, and then the first vaccination takes place. And the nurse does this manually. It's by default, enters the name and date of birth and into the ACR, because that's the policy for keeping track record. The ACR should do that. Now, what we're saying is just a mobile number space is added in that on that website, and they put in the mobile number, and boom, you get SMSs every day.
So this is the whole thing over here, the ACIR itself.
Okay.
So we have added this feature of generating SMS. This is already existing, which is maintaining all the records. All we're trying to add is adding an SMS. So whenever you visit, it automatically detects everything and just sends out an SMS.
So do you think it's going to be achievable within the time period?
Pardon?
achievable within the time period given?
Within the time period of 2 years?
Yes, we believe so, yeah, because it's all about authorization
Okay,
and.
I'm gonna have to wind it up now.
Yeah, it's all about getting an authorization, adding on a feature, that's it, yeah.
Okay, give them all.
Right, thank